Today I'm going to talk about cavernous malformations, CAVMAL. Cavernous malformations are vascular malformations that are lined by endothelia. So the test of choice is MRI brain with contrast. MRI brain is better than angiogram for diagnosing cavernous malformations. So what do you find on brain MRI is popcorn shaped abnormalities. Means central hyperechogenic means calcification, hemorrhage surrounded by a rim of hypointensity. Usually, cavernous malformations have less risk of bleeding when compared to aneurysms and AV malformations. The risk of bleeding is associated with two factors mainly. That is intracranial hemorrhage, previous intracranial hemorrhage secondary to cavernous malformation, or brainstem location. AVMs in cerebellum, AVMs in pons, they have higher bleeding risk. Thank you. I'm going to speak about presentations of cavernous malformations. So the cavernous malformations, 80% are acquired and 20% are familial. In the familial, based on the location of the gene, CCM1, also known as CRIT1, and CCM2, there is people who have these genes have higher incidence of cavernous malformations. The other very important point that is tested in the examination is cavernous malformations are associated with Joris venous anomaly, almost 30 to 40% of the cases. The pathophysiology is in DVA, dural venous anomaly. There is increased pressure in these veins and it pushes back and it exerts pressure on the cavernous malformation. So because of that phenomena, the usual presenting symptoms are seizures, focal neurological deficit, and rarely headache. The occurrence of bleeding in cavernous malformations is based on previous bleeding due to the cavernous malformation itself or brainstem location of the cavernous malformation. Today I will talk about the treatment options for cavernous malformations. Mainly if the patient has increased seizure frequency or increased bleeding risk, then we treat cavernous malformations with surgery. After surgery, it usually takes 1 to 2 years, but by that time, 60 to 80% of the seizures are controlled. In general, cavernous malformations, the bleeding risk is less, so we watch the progression of the cavernous malformations.